He is very well now. We keep him in a post-operative care. He is still unconscious. You don't need to worry. Okay?
Okay. Can I see him, doctor?
Not now, but as soon as I shift him in a patient ward, then afterwards you can see him. And if any complications we get to know, we will inform you.
Okay, thank you, doctor.
Okay.
First, we will measure the vital signs of the patient, like pulse rate is 90 right now and the respiratory rate is 20. Then we'll measure the blood pressure of the patient. The consciousness of the patient according to the Glasgow scale is right now at 9, and the skin and the mucous membrane of the patient is moist. Blood pressure of the patient is right now 130 by 90 and the temperature is 38 degrees. We'll also do the examination of the abdominal area of the patient and check if there is any activity of the GIT or is there any complication after the surgery. The urine output of the patient at the time of the examination was 300 ml. It is yellowish in color and there is no blood present, and the drainage from the wound is 50 ml and from the nasogastric tube 10 ml.
Hello? How are you feeling? Are you feeling pain? Okay. Is it severe, moderate, or mild?
Moderate.
Okay, okay. Did you feeling any nausea?
Yes, doctor, little bit.
Okay, okay. Don't worry. We have given some medications and you will be fine. The nausea and dizziness is normal.
At 5 o'clock, we'll do another examination of the patient. The pulse rate of the patient is 78 right now, and the respiratory rate is 18. Then we'll measure the blood pressure of the patient, which is right now 120 by 90, and the temperature of the patient is 37, and the consciousness is 15. Skin and the mucous membrane is normal, and the drainage from the nasogastric tube is 10 ml and from the wound is 50 ml, and the urinary output in the last 2 hours is 120 ml, and the pain in the abdominal region is at the level 4 and there is no activity of GIT. And the lab results and the X-ray does not show any complications. We'll do another examination after 4 hours and all the parameters looks normal. Since there was no activity of the GIT, we kept patient at 2 NPO, and to maintain the fluid balance we administered 2400 ml of finger selected solution. It is the second day of the post-operative period and we will continue to monitor the patient's vital signs and the lab results in the interval of 6 hours. Right now patient's pulse rate is 90, the respiratory rate is 18 and the blood pressure is 130 by 90. The temperature is 37 and the consciousness is 15 and the urinary output was 300 ml. It was transparent in color and without any blood traces. During the examination, there was no drainage from the wound. We chose to remove the drainage pipe and the Foley's catheter. Since there was no activity of the GIT, we choose to continue the NPO diet. We'll do another follow-up examination at 3 o'clock and 9 o'clock respectively, and all the parameters seems normal and the urinary output is also normal. There is no signs of complication. Today we choose to administer combination of normal saline and dextrose 5% solution, and we administered 2400 ml of solution in this manner. To combat the infection, we chose to give 2 doses of third generation cephalosporin cefotaxime in the gap of 12 hours. We continue to monitor the patient in the interval of the 6 hours. The patient conditions are improving. Right now the pulse rate of the patient is 76, the respiratory rate is 18, the temperature is 36.9. The skin and the mucous membranes looks moist and the consciousness is 15 and the blood pressure is 120 by 85. There's no bleeding at the site of the surgery and the abdominal pain is reduced. There's peristalsis and the fertilation, which indicates the GIT activity is resumed. So the diet of the patient can be changed to clear fluid and the NG tube can be removed, and the urinary output has also increased. But we will still continue to administer the fluid through the IV line, but the amount is reduced to 1000 ml, and we administered 500 ml of normal saline at 9 a.m. in the morning and 500 ml of dextrose 5% 7 in the evening, and we'll continue to administer the third generation cephalosporin to combat the infection.